Well, a warm welcome to today's update. It's Saturday evening, the 12th of February. Now, I'm going to be looking at some updates from different parts of the world. We notice, for example, in the States that cases are falling down dramatically and they're being followed by hospitalisations, and there's just the indication now that deaths are starting to go down in the States, but still high. Likewise, in the UK, cases are still really quite high. Now, most of the lateral flow tests, or certainly a lot of the lateral flow tests that are being done in the UK are not being reported, so they're not coming through as cases. But the actual infections are high, and that's where the COVID symptom tracker data comes in. So let's look at that now. This has just come out a day or two back, and we see that cases went down, then they've gone back up. Now, it's tempting to say that this sort of bounce back here is caused by the increased infectivity of Omicron BA2. We don't really have enough data to say whether that's true or not, but it could well be that we're going to see sort of cases going up and down, waving around a bit between now and when the better weather starts, really, when cases will start to go down. But of course, all of these people that are being infected, currently 1 in 25 people in the UK are symptomatic. They're all generating immunity, certainly personal immunity, and contributing towards the herd community immunity, which to me has changed the sort of risk-benefit dynamic of our overall strategy to this pandemic, as Omicron goes around giving lots and lots of people high levels of protection. At least we believe it's high levels of protection. We've seen from American data that infection with Wuhan type or Alpha type gave very high levels of protection against Delta in the United States, better than people that had been vaccinated, in fact. More protection against reinfection, more protection against hospitalisation. So natural infection really is the way to go, and I feel it's changed the risk-benefit analysis. That the African doctors told us that it's changed the Omicron is the vaccine we failed to make, or we failed to distribute to Africa, if you're listening from Western countries. But let's start with this. So we've seen that one. We've seen the cases go up and down there. And really pretty high. The prevalence is pretty high. So over 200,000 people currently symptomatic in the UK. Now, this is the incident figures resulting over time, total number of new cases, symptomatic cases. Now, the first one there is the red line in people that are fully vaccinated with 2 doses of vaccine, and this one is in the total number of people. So in a sense, this is the subset of this. And we see that they're following each other quite closely, really. So people that have been fully vaccinated are getting infected with Omicron, as are people that are unvaccinated with Omicron. So we see a lot of breakthrough infection, even in doubly vaccinated people, as of course we know with Omicron. But thankfully, it's a lot milder. Now, this is incidence by rate by region in the UK. So this is, yeah, well, I mean, it's all going up here, isn't it, pretty well? Is there anywhere going down? Maybe the northwest going down a little bit there, probably. London in green, very high peak. The rest of the country didn't follow. London went down, down, down. Now it's going up, up, up. And now it's just started to go down again. So they're the different areas in the UK, and the Zoe statisticians have included the error bars on that data now, which is good. Incidence by age group. Now we see here the 0 to 17. This scooted up after they went back to school. Starting to go down now a little bit, and we know, I'm getting reports of hundreds of children that have been infected. Mostly very minimal. Typically just a sore throat, often just for a few hours, and very, very minor symptoms. But the parental generation, of course, has followed the children's generation, because the children bring it home from school, they give it to the parents in the 18 to 54-year-old age group. But we do see the 18 to 34 age group is currently going up. Thankfully, we're seeing relatively low cases in the 55 to 74s and in the 75s and over. So that's the split by age group. Now this is comparison of new onset cold-like features, common cold-like features, and we are going to do an update on the cold features. So the blue line here is COVID with respiratory symptoms, and this is respiratory symptoms that are caused by non-COVID. And we did see that for a short period of time there was actually more colds in the country caused by COVID than there was by other cold viruses. But now we still see a lot of the common cold symptoms are caused by COVID, as indicated by that blue line. And it's always worth looking at this. How accurate is this data? So what this slide is doing is it's comparing the Zoe COVID symptom tracker data with other sources of data, and it's working out really remarkably well. It's just a pity more people. I've been advertising this app, of course, all the way through. It's just a pity more people don't do it, and you can download it in the United States as well. And more news later on further projects post Omicron, where Tim Spector is going to be collecting data. So what we see here is this is the REACT study. This is the Imperial College London study, where they just collect data for a period of time. But we do see it matches the pink line, which is the COVID symptom tracker data, fairly well. And the yellow stars there are ONS data, which is eventually reported. And this is ONS predicted data. And of course, the ONS data is typically a bit higher than the COVID symptom tracker data, because the ONS data is including all people that are infected in their survey, whereas the COVID symptom tracker data is only counting those people that by definition are symptomatic. So there we have this, 1 in 25 people infected. Now, Omicron BA2 is spreading. 6th of February, it was 17% of the population. Now, this is a surprise. And I'm just wondering how accurate this is. Because we saw the way that Omicron spread very rapidly through... Omicron spread very rapidly, then BA2 rapidly took over from BA1 in Denmark. We expected that to happen in the UK. It doesn't look like it is, although testing is a bit of a problem. But this has been put together by East Anglia University, and we think this is fairly accurate at the moment. So, OK, it was 6 days ago, but 17% of the population with BA2. Still Omicron, of course. Northeast, only 5%. London, 30%. Omicron is turning out, or BA2 particularly, is turning out to have a 3-day incubation period, so a bit shorter than the previous strains. And the numbers are doubling every 8 days. So we do expect BA2 to become the dominant feature, the dominant strain, but it hasn't kicked in as quickly as it has in Denmark yet. Now, I want to hear from Tim Spector now, because Tim, how have you been feeling?
Tim Spector here of the Zoe COVID study, giving this week's update. I'm doing it from a state of isolation, as last week I caught Omicron, and that probably explains my loss of energy and being bunged up. And I have every sympathy for all those who've been reporting it to us. It does start exactly like a cold. Can't tell it apart, except much more fatigue than I've ever had with a cold. And it lays you up for a couple of days, and you really don't feel like doing anything. And then you just get congested, and it slowly wears off, but takes forever. I also had back pain, like many of you did as well, but only lasted about a day. And really, I'm over the worst of it now. But according to the government, I wouldn't have COVID because I didn't have any of the classic symptoms, like half of you. Thank God for lateral flow tests, eh? And I was also super careful, and I've been basically working from home, hardly saw anybody, so it's still a bit of a mystery how I managed to get it. And I think that is just testament to what we're dealing with here, a very clever, highly infectious variant. Tim Spector here of the Zoe.
Thanks for that, Tim. And of course, I'll post the full links to Tim's video. So a couple of things there. The fact that the government hasn't updated the symptoms to recognise for COVID, it's now become laughable. I mean, why on earth is the government still reporting symptoms from getting on for 2 years ago now? It really is a joke. It's a complete joke, as Tim said there. He couldn't believe it. So let's just look at the up-to-date clinical features that are being shown by the data. Most people get a runny nose, a lot get a headache, sore throat, fatigue, sneezing, persistent cough. Are what people are complaining of most. This is from about 750,000 reports, I think. Next, hoarse voice, chills or fever, joint pain, actual fever that's being recorded, dizziness, brain fog, that horrible sort of clogged up that you're not quite with it feeling. Sore eyes, altered sense of smell, muscle pains, lower back pain, as Tim himself had, swollen glands, chest pain, skipped meals. And Tim actually had the wild type, and in March 2020, the original Wuhan type, and said this is completely different. This is completely different. Now, the metallic taste. Now, I'm just going to play you this because I'm pretty chuffed with this. Let me just play you this clip from Tim.
Been looking at some rare side effects of vaccines, symptoms, and one of them is metallic taste in the mouth. And this followed some conversations I had with the eminent doctor John Campbell, who was postulating that some of these rare side effects of vaccines could have been due to excessive doses that might have been signaled by something else going on. And one hypothesis was that metallic taste in the mouth was a sign of that. So based on his hypothesis, we did look at this, and over 5,000 of you reported having metallic taste after a vaccine, and 3.6% of you. And we discussed those results in another video, which we provide a link to. So have a look at that if you're interested in those sort of rare side effects and you had metallic taste.
That's really great that Tim's done that. We had a conversation on the phone, a couple of conversations. It must be probably about 2-3 months ago now, and we talked about the metallic taste and the inadvertent intravascular administration. And so Tim kindly put that on his survey, and it turns out that 3.6% of people reported a metallic taste, over 5,000 reports. And the issue there was that some people reported a metallic taste really quickly, which I considered likely indicator of inadvertent intravascular administration, which of course we don't want. Now, having teased us with that video yet, I don't think Tim's actually provided it yet, so we're gonna have to wait for that. But pretty interesting, and it's great that that Tim saw fit to put that on his COVID symptom tracker data. Got people to report on that. Now, what the heck? Just what is going on in Hong Kong? It's just bizarre. Zero COVID policy. We can't stop Omicron, especially BA2. You can put it off for a while, but you can't stop it. So why would you want to expose your population to Omicron when a lot of the vaccines had worn off? The only reason for trying to keep it out is to vaccinate more people. Now, in Hong Kong, not enough old people have been vaccinated, so there is a problem there. So hopefully they're using this time very wisely to vaccinate as many people as possible. But you can't stop COVID. We have to live with it. We can't stop it. It's not a stoppable virus. It is incredibly infectious. As Tim Spector said there, he doesn't know where he got it from. He's basically been isolating, and yet he got it. I mean, I was talking to some people in the outback in Australia, and they said they come into town once a fortnight, do some shopping with a mask on in the supermarket, then dash home again. And living in the outback in Australia, they got it. This is a massively transmissible variant. We can't stop this. And it's good because it's producing mild disease and generating huge amounts of personal and herd immunity. So, in a sense, why would we want to stop it? And yet this is the track Hong Kong is taking with draconian measures. This area has been locked down for 7 days. Supplies have been cut off. Now, the authorities are providing meals, but apparently they're far too oily and terrible. And garbage is described as being like a mountain. You know, the areas are just being cut off to try and stop the unstoppable. I don't know if you have the story in the States, but in the UK we have the story of King Canute, who was a pre-Norman Anglo-Saxon king. And it's not true, of course, but he thought he was so powerful he could stop the tide, and he put his hand up and said, "Stop, tide must stop." But of course it came in and got his feet wet. Obviously, no disrespect to King Canute, it's an anecdotal, it's an apocryphal story, but it just shows this can't be stopped. Can only be delayed at best. So why they're doing this, I don't know. A lot of flights suspended. Cases have gone up. This is actually a couple of days out of date now, but they're getting quite a lot of new cases. 4,000 people are in government-run centres, basically isolation centres. Limiting outdoor gatherings to 2 people, closed religious sites and hair salons. Carrie Lam, who's she would probably claim to be in charge in Hong Kong. At this moment, we still feel that this is the best strategy for Hong Kong. I don't think so, Carrie. Where did you get this idea from? It really seems rather strange. Beijing saying a deviation from the policy would be disaster for the city. So Beijing seemed to be thinking it would be a disaster for the city. I would say, instead of disaster, I would say utter inevitability. Over 80s, 22% have had 2 doses of vaccine, so there are going to be some older people. If they're using this time to mass vaccinate the older population who are more at risk, then so be it, but I'm not sure that's happening. Just half of those between 70 and 79 are vaccinated, so surprisingly few people taking up the vaccine, especially in the older age groups. Now this is interesting. Wastewater analysis. And this has got implications for a lot of other diseases as well as Omicron. So this is just a story that caught my eye. Centres for Disease Control, they're going to expand their wastewater analysis. I mean, basically the genomic surveillance in the States has been poor. So they're expanding the wastewater analysis to give early warning to find other deadly pathogens. So they're kind of learning from this pandemic, which is good. Control outbreaks of foodborne disease as well. Now, 40 to 80% of coronavirus infections shed viral genetic material in their faeces. Interesting. So if someone's infected with coronavirus, even if it's asymptomatic, between 40 and 80% of people shed the virus in their stools. Now, I'm not worried about people catching it. I don't think sewage workers are going to catch it or anything like that. The concentration is much too low. But it's very useful for monitoring purposes because very small amounts of RNA can be picked up by PCR amplification, as indeed can the genetic material from a range of other viruses, bacteria, and indeed fungi that can cause problems. So 40 to 80% shedding virus, even if asymptomatic. It's an early sign of infection, so this happens really quite quickly. Increase in wastewater virus levels 46 days before health officials notice any change. So this means a local area can have a heads up of 4 to 6 days before people start getting symptomatic. So it looks like one of the first clinical features of infection is people start basically pooing this virus out. They are excreting it in their stools. That can be detected in sewage before local health officials have started to notice the new cases. Interesting, and it's got implications for other things. So Amy Kirby, CDC wastewater surveillance system, says this. These data are uniquely powerful because they capture the presence of infection from people with and without symptoms, which is, of course, true. So with and without symptoms. And are not affected by access to healthcare or availability of clinical testing. So it's a population snapshot, which is a good idea. Also, she's going to start testing for antibiotic-resistant bacteria, which of course is a major and increasing problem. Norovirus, winter vomiting, well, more winter diarrhea bug really. Influenza, Candida aureus, which is a particularly nasty fungal infection. E. coli, especially the I think it's the 0157, which can cause HUS, hemolytic uremic syndrome, and salmonella, of course, which makes you really sick. So great, all these things can be screened for. Currently coronavirus data from 400 testing sites, 28 states. They've so far collected 34,000 samples, which is rubbish for the country the size of the states, and they're doing some genetic sequencing, but they're trying to improve it, so we'll give her full marks for that. Early warning, situation awareness, direct mobile testing to the places that might be needed, dispatch mobile testing teams. Basically, this is good practice for the next pandemic. So, and I think we're going to see a few things like this, good things that are coming out of this pandemic. Readying additional healthcare provision in the area. Boston concluded that Omicron had peaked using water sewage. So while they were still getting quite a lot of people infected in Boston, the actual amount of the virus in the sewage was going down, and from that they predicted that the virus had already peaked. So quite an interesting tool, really. 2 out of 255 surveillance systems, 70% decline in virus over the past 15 days. Now, this is actually, I actually prepped this about 3-4 days ago, so now it's even more. The incidence in the States is plummeting. But in some areas, as we've said a few days ago, 30% reported increases, but overall in the country now it's plummeting really quite dramatically in cases. Now, just mention that sometimes some of your comments sort of just deserve repeating, really. Andrew, remember we talked about the fact checkers, the Facebook fact checkers that fact checked me and fact checked the British Medical Journal, founded in 1840. Some of you thought it was somewhat arrogant of these fact checkers to do that. But anyway, Andrew, about fact checkers, the thing is, articles in journals like the BMJ are already fact checked. The process is known as peer review. I couldn't agree more, Andrew. And of course, the editors of these journals send it literally to peers. So if you've got medical researchers that day in a particular field, so you have a medical researcher in neurology, they're not going to send it to a medical researcher in cardiology. They're going to send it to someone who is genuinely their peer, who knows about medical neurology or whatever it is. Or if it's a COVID paper, they're going to send it to someone who knows about COVID or knows about infectious diseases or epidemiology or whatever it is. They are genuinely peers, not some jumped up fact checker who puts a label on the button one day saying fact checker, as if that makes them some sort of omniscient authority with direct communication to the oracle at Delphi or something like that. It's pathetic. So I completely agree with you, Andrew, as you might have gathered. Before an article in a decent scientific journal is published, it has to be reviewed by experts in that field. Of course it does. Of course. They look at the methodology used in the work and check to see that the conclusions arrived at are reasonably made given the data which the experimentation has produced. That's exactly what they do. High quality journals like the British Medical Journal only publish work out of the very best scientific rigour. For Facebook to think that they know better in this process is pathetic in the extreme. Let me think. Yes, I agree with that. And finally, Aaron, I said when we were looking at Orwellian trends in media and data management that George Orwell died in 1951. Sadly, George Orwell died in 1950, January, I believe it was. So I actually knew that. I just said it wrong. But in other words, I was wrong. So thank you for that correction, Aaron. George Orwell, in fact, died in 1950. Died of tuberculosis. And remember that clinical trial we looked at on streptomycin, the first antibiotic for tuberculosis. That data was published in 1948. And although George Orwell was on streptomycin, the tuberculosis, unfortunately, was already too advanced. And he actually started writing it in 1984 and 1948, of course. If the streptomycin had come just a couple of years early, we could have had George Orwell with us for another 30 years quite easily. Such tragic. Right, now I'm going to close with a video from Wafafa, our community health partner, of course, in Uganda. Now, one of the problems there is old people aren't, well, basically they're just dumped some of the time. So over to this video about, it's only 3 minutes, just watch it, about Granny getting a wheelchair after being bedbound for 18 months, a couple of years, and then all of a sudden she goes for a walk around the village where once as a young child herself she frolicked with gay abandon. She was able to revisit that. Just watch it. It's really quite moving.
And we brought for her a wheelchair because she was not able to come outside. She could just sit inside all the day. So one of our subscribers suggested that we get her a wheelchair. and they have contributed for it. We are also going to get her a seat where she will be sitting, maybe when she started of sitting on a wheelchair.
Change your 41.
Hey, thank you everyone.
Change your 41.
May God bless you all.
And go to school.
Waliyo wele umuyeti webana mulekwa bosi ulinda binywinywi mubanga bisolo mumezi. Waliyo wele, waliyo wele, waliyo wele, waliyo wele, isi wisaya niyo hulinda. Waliyo wele, waliyo wele, isi wisaya niyo huyeta. Ulisindu sishowo Jemupanga vivyoho, jemumbetini vyekwiswa vyosi vivyoho. Ulisindu sishoho, ewezapu uowo, singingini tinyanza vyosi vivyoho. Ulisindu sishowo.
So guys, we've been able to move her on the wheelchair, as you've seen, and now she's seated outside. Thank you very much for your support. Thank you very much for bringing a smile and changing the life of my grandmother. There are many people who are in her situation, but we shall be helping one at a go, and with time we shall have a changed community. Thank you very much for watching. See you in the next video.
Great thing about Rafafa's videos, you get music. If I was to sing on mine, none of you would watch. So that's great, Rafafa. Thanks for that. Thanks for the music. That was just one of Rafafa's subscribers made that donation, but we wanted to make that to illustrate the problem well, she'd been stuck in the house about 18 months, 2 years, and already that video is having a positive effect in Uganda, increasing awareness of the isolation really and the loneliness of older people who are often really pretty lonely in their homes. So that's good. Hopefully we'll get hundreds more similar wheelchairs and get lots of older residents knocking around their villages again. Great to see, and thank you for watching.